Good morning, good evening, good afternoon. Man, if you were snowed in, I hope you got out. I hope you were able to dig out because it hit the whole mid Atlantic. I know, newsflash, God can shut the whole country down and make you do something. Think about something. Think about those less fortunate people who might be on the street, people who don't have any heat, and the things that we take for granted. All of a sudden, we think about more than others. I think the weather and the supermarkets are working together because it seems like I went to the store and I'm in Georgia and all the bread was gone. And this was before I had looked at the weather, and this was like a week back. I don't know why that's still on my mind, but welcome to the Chicken Box, everybody. I'm your host, Impeccable. The Chicken Box is powered by the Afro American newspaper, now Afro News. Used to be a newspaper, now we're a media company, the oldest Black media company in the country, 133 years. Shout out to the Afro. If you haven't been to check us out, go to afro.com and discover the archives of powerful people of color who've been doing amazing things and amazing stories. Sometimes you got to go somewhere where there's the good news. But this is the Chicken Box. So if you're from the Baltimore area, you know what a Chicken Box is. 4 wings, fries. It's lunchtime, and I didn't eat breakfast, so this might just make me hungry a little bit. A little salt, pepper, ketchup. You know, you get the fries, the box gets greasy. But here at the Afro, the Chicken Box is where you come in and you speak your truth. Is where you get to talk about whatever's on your heart. And the great thing about the Chicken Box, we don't have to agree with you. Isn't that wonderful, people? If you like blue and I like brown, why are we fighting? Anyway, today's fight, though, is against hunger, feeding communities, and changing systems. And I said all of that about the food is how much we probably spend and over have food, and then it's people who don't have enough. So we have a special guest today joining us, LaMonika Jones. LaMonika, welcome to the Chicken Box. How are you?
I'm good. How are you? Thank you so much for having me.
Fantastic. DC Hunger Solutions. I could read all of this about you, but I have you here. And so why don't you let everybody know like what you have going on with DC Hunger Solutions? And then let's just get into a little conversation um, and really dive into what drives you, what drives DC Hunger Solutions, and how we can help get your message out.
Yeah, absolutely. My name is LaMonika Jones, and I oversee our work at DC Hunger Solutions as well as our sister organization, Maryland Hunger Solutions. And so both DC and Maryland Hunger Solutions are two state initiatives of the Food Research and Action Center, which more commonly known as FRAC. But FRAC is a national anti-hunger organization, whereas our work in DC and Maryland does exactly what our name suggests, is that we work on the ground statewide in Maryland and across DC with addressing anti-hunger, poverty, as well as its root causes that are impacting our community. And so, our work, we've been around, DC Hunger Solutions has been around since 2002, and Maryland Hunger Solutions has been around since 2007. A lot of our work is really centered on addressing, like I said, those hunger, anti-hunger issues, food security issues that impact our communities. In DC, we serve the entire district, but we are prioritizing our communities that are most in need. So our older adults, our immigrant mixed status households, as well as our communities east of the river in Ward 7 and 8. Um, we advocate in both jurisdictions for increasing participation in our federal nutrition programs. But we also have a policy component to what we do. And so that means meeting with our legislators at the state level in Maryland, as well as DC council members, to bring forward viable solutions that are going to make sure that not only are we addressing hunger and poverty in our communities, but we are also doing so, making sure that we are doing it with racial equity in mind. We want equitable solutions. We want to make sure that we have a racially just food system in both DC and Maryland. So that's a little bit about our work and who we are.
Absolutely. Welcome to the Chicken Box. So what does the average American wake up and think about people without food?
Unfortunately, I don't think so. I think if we did, I don't think I would have a job right now. I don't think that if every person had access to food, if every person was able to connect to a food resource, I don't think we would be in the position that we're in right now when it comes to food insecurity. My goal is to work myself out of a job. I want to make sure that every person has access to food and that they're able to nourish themselves as best. I always say food safety and shelter are the three things that we have to address first before we begin to talk about other outlying issues. But that's why we do what we do, is because food is oftentimes it's the last thing that we think about. Kids get breakfast when they go to school, but I don't think that it's prioritized. And so that's exactly why we exist and why we do the work that we do, is to make sure that people are thinking about food first, because we can't do anything without food and nutrition.
Absolutely. I mean, like, oh, are we saying that the current policies we have are failing us? What does that look like? What policies are failing us? I know, back when we were younger, we used to save food stamps, and then it changed to SNAP, then it changed to SNAP and WIC. Um, and I don't know, maybe our viewers, they may have never heard of SNAP and WIC. Why don't you start with there, and then we can say maybe how the policies are failing.
Yeah, no. That absolutely. So, for those that may not be familiar, SNAP, which is the Supplemental Nutrition Assistance Program, it is a program that, but most people still call it food stamps. Um, it is a program that is funded by USDA, United States Department of Agriculture. It is our nation's first line of defense against hunger. So, anytime an individual is experiencing hunger, as long as they meet those household and income requirements, the first thing that they do is they apply for SNAP. They used to be colored money back in the day. Now everyone has an EBT card, which makes it more usable when we're at grocery stores, we're at corner stores, online grocery shops, wherever. Um, our current challenges that we have with SNAP, with the system right now, have come out of HR1. We have advocated previously very heavily for advancements with SNAP. DC was one of the first quote unquote states in the country to have a SNAP supplement amount. At the time, our SNAP benefits were about $15, $16. And, our work started with a simple conversation with an older adult who said she just wanted to be able to afford blueberries. And we worked with DC Council to invest in a local supplement and pass legislation so that there was a locally funded supplement amount that at the time boosted those benefits by half. And so residents were receiving $30 as a minimum. During the pandemic, there was a lot of work that was done to boost that at
When
the
you say
federal.
$30, was that $30 a month? $30 a day?
$30 a month. So the minimum was $30 a month at the time, back when it was much more affordable to have $30. We know that that's no longer affordable right now, but $30 back in 2015 was a little bit more as a minimum. That's just the minimum, not the maximum, just the minimum amount. That was more affordable. It was better, a better solution at the time.
Okay.
During the pandemic, through the Thrifty Food Plan, which is how the federal government determines what the minimum SNAP benefit is going to be, that was boosted from $16 to $23. And that's currently where it stands right now. We advocated quite extensively over the past year and a half, maybe, when we found out about HR1, the SNAP impacts that were going to affect our recipients across the country. Within HR1, one of the most devastating cuts that we're seeing has come in the form of the time limits or work requirements. With our work requirements for our SNAP clients specifically, a dependent was previously 18 and under. Now a dependent is anyone that's 14 and under, as well as you would have to meet these work requirements, which are 80 hours per month or 20 hours per week, whether it's traditional work, an employment training program, or a another form of volunteering. Most states are calling it workfare. Um, you previously between 18 and 54, you'd have to meet these work requirements. Now it's 18 to 64. So what we're looking at now is our older adults that are between the ages of 54 and 64, many of whom have retired. They are now having to go back to work in order to maintain their SNAP eligibility, as well as the comparison I always give is imagine you are 62 and you have a 16-year-old, you're maybe a caregiver for a 16-year-old. You have to go back to work to meet those work requirements to maintain eligibility for SNAP. That's an undue burden for a lot of households that are experiencing, disadvantages. And so through HR1, there's been a lot of cuts that are impacting primarily our communities of color, as well as our older adults. There's exemptions that are no longer in place or effective for our veterans, our unhoused individuals, as well as our youth that are 24 and under that have aged out of foster care. So there's been a lot of cuts to SNAP through HR1.
Absolutely. If you just tuned in, this is the Chicken Box. We are talking to LaMonika Jones from DC Hunger Solutions. We're fighting against hunger, feeding the communities, and working on changing these crazy systems that we have. We also have joining us now Dr. Toni Draper, CEO of the Afro. She joins in on the conversation. Welcome to the Chicken Box, and let's keep it moving. Hunger is a thing. I get hungry when I maybe go like 8 hours without eating, but I can imagine. And thank you for bringing just this topic to our audience, because people get so much, they spend more time on TikTok than thinking about somebody else. And probably there's other solutions that a person, their Uber Eats fee could probably help feed somebody. So, Dr. Draper, jump in.
Hey, welcome, LaMonika. We're so happy to have you with us on today. It's a real issue. So I heard you say that a lot of changes, including the age requirements and the back to work and all of those kinds of things, not to mention the fact that food is exorbitant. Whether you have a SNAP benefit or not, food is just super, super high. And so tell me a little bit more about, and I apologize if you all already went through all of this, but what DC Hunger Solutions does in those cases. If somebody is in that situation where, they either can't go back to work or don't have the child care, or they just don't have the food, really, what are you saying to people? Are they coming to your office? Are they calling? Are they how are they interacting, and what's the next step for people who really and there are a lot of people in this situation too.
No, absolutely. So, one of the things that we do, I always remind people, we do everything except distribute food. So we don't touch any food. We rely on a lot of our partners in both DC and Maryland to handle that. But if we have a resident, and I oversee, whether it's a resident that lives in DC or in Maryland, when they call our office, a lot of our work involves direct service. And that means directly providing support to our residents in either jurisdiction so that we can support them as best we can. So, we have a client that may call us and, they may say, I need to apply for SNAP. That involves us pre-screening them, number one, for eligibility, because SNAP does have a requirement, a household and income requirement. And so we want to make sure that you are eligible for SNAP. If that client is eligible, then we'll follow through with assisting them with the application process and working with our state agency to ensure they're able to receive benefits. And in the meantime, while they're waiting for those benefits to receive those benefits, we will connect them with emergency food resources. So we have relationships with several of our food-based partners that are distributing food across DC and Maryland. We will connect those clients with those partners so that they don't miss out on an opportunity to feed themselves. In a very rare case, in the event that we have a client that is not eligible, one of the things that, through HR1 that has impacted our households is our humanitarian eligibility. So our asylees and refugees are no longer eligible, as well as this impacts public charge has become a new thing, and public charge is a whole different conversation. But in the event that someone is not eligible, for SNAP for various reasons, if they're a mother, even if they're a father or grandparent that has guardian of a child that's under the age of 5, if they are prenatal, we will connect them with WIC. And so we will utilize our resources to make sure that they know how to visit a WIC clinic so that they can sign up and begin to receive WIC if they qualify. So our responsibility really is, when we're talking to our client, it is making sure that we are connecting the dots in every space possible so that people can do what is very basic, which is feed themselves. And then, on the outside of that, it is connecting them with other resources. So we don't work closely with Medicaid and TANF, but we have partners that do that, as well as, working with our legislators to make sure that these programs are accessible and they're adequate for our residents.
Okay. So what's the average wait time if somebody comes into your offices, or can they apply online? I don't know how they make the application. So from application to some kind of determination, how long does that take?
So we're able to assist clients in a couple of ways. So they can either email us for assistance. They can pre-screen themselves. So we do have a pre-screener on our website. So if they go to dchunger.org, there is a box at the top of the screen, top right side of the screen, that says apply now, and they can go through the pre-screening process, which will let them know, just asking a couple questions. And usually it is a 2-3 minute process to determine if they're eligible. And then if they are eligible, they can then reach out to us and we will walk them through that process. It really does vary. So it is on a first come, first serve basis for all of our clients. But the minute that you either receive it, we receive an email, we receive a call. For some clients, we have a text, so they will text us for support, or if they have a question, they'll text us. But it's a first come, first serve. And the average, we try to respond to everyone within 24 to 48 hours, even if it's just an acknowledgement that, yes, we're here to help you, and this is just what we need. So we'll set up an appointment time that works best for the client. And then we'll follow up from there. But it is on like a first come, first serve basis. But it really does depend. The length of the time to complete the application depends on your household size, medical deductions, so on and so forth. So for like an older adult that's no longer working, that doesn't have any dependents or any income, we can usually breeze through that application pretty quickly. And they would be eligible for expedited benefits, which means that they would get their benefits in 7 days. But it could take a little bit longer for a client that has more dependents, more deductions, a larger household size, because it takes time to get all your paperwork together.
Right. We're fighting against hunger. We just tuned in. This is the Chicken Box, powered by the Afro American newspaper, now known as Afro News. We have a question from, I hope I don't mess your name up, Tamiwa. He said, this is an interesting topic. I'm quite new to understanding the U.S. system and how things work. I was wondering whether there was a way to go back to having an initiative like a city farm.
Absolutely. So a lot of the work that we do in both DC and Maryland is advocating for our local economy. So I sit on the executive committee for DC's Good Food Purchasing Coalition, as well as for the Maryland Food System Resiliency Council. And so with both of those coalitions, it really is, a part of that is looking at resources that support our local economies. I'm a product of small businesses. I really believe in small businesses. And we really try to work in both jurisdictions to reduce the carbon footprint of our food system, which means prioritizing and focusing on how can we serve those food items that are a little bit closer to home. So a lot of this work, for example, is being done in our schools. And so making sure that there's intentional funding for our school food and nutrition staff to purchase from local farmers. And those that are close by and are able to serve the need. I've got a pretty extensive food procurement background, which is how I got into this. But it really is definitely that's something that's doable. We have a lot of small footprint farmers and growers that are across the DMV region. And so a lot of our work is determining how is it that we can support our Black, people of color owned farms in our communities, because it is through that local sourcing that we're going to boost our local economies.
And thank you for that. And I think there still is a Black Church Food Security Network that the Reverend Dr. Heber Brown started. So you sounds like you're familiar with that. Okay.
Yeah, absolutely. I had actually connected with Reverend Brown a couple years ago when I had first moved to Maryland. And so that is some amazing work that's going on. And I've been able to sit in on coalition calls and to listen to the work that's being done just in the DMV region with our Black farmers and growers, even from those that are outside the DMV region that really are interested in doing business. And that's what we want to, part of our work is influencing the entire food system. It's not just looking at our federal nutrition programs. We really want to impact the entire food system. You know, our goal is to end hunger in the nation's capital and to do the same thing in Maryland. But a part of that is making sure that we have a racially just food system and that we're able to support a food system that does honor and respect local sourcing as well.
I was looking at your website, excuse me, and it said that nearly, I don't know if you guys knew this, 11% of households in DC struggle to afford enough food despite an improving economy. And with households with children, 13%.
Mm-hmm.
So we have about 700,000 residents in DC. Out of that 700,000, we have about a little over 140,000 that receive SNAP. Of that 141,000 that are receiving SNAP, 50,000 of those, a little under 50,000 are children. And so, you know,
wow.
Hunger is pervasive. In Maryland, it looks a little different. In Maryland, we've got about 680,000 residents that are receiving SNAP, and 270,000 of those are children under the age of 18. And so these individuals are, when we talk about hunger, it's not just, I haven't had anything to eat today. It really, have I had enough to eat today? And that's the piece that sometimes is forgot about. So, you know, some of our work in DC was through a legislation called the Healthy Tots Act. And the Healthy Tots Act allows childcare centers and daycare homes to serve an additional meal during their program day. So you figure a 3-year-old, their bellies are smaller and they have to eat more often. They typically get breakfast very early when they're dropped off at daycare in the morning, 7 o'clock. Then they eat lunch, probably 10:30, 11 o'clock. They may not eat again until later on the evening when mom or dad makes dinner. They may have had food, but it may not be enough food for them to nourish their bodies in the same way for just an average person. You know, it's not just the complete absence of food. Yes, that is very prevalent, but it is, have I had enough food to eat today? And have I had enough of the right food? And that gets into the conversation of food security versus nutrition security.
Mm-hmm. And let's talk a little bit about, you talked about it somewhat, but the underlying systemic issues around this, because sometimes people mistakenly think, well, like with this new legislation, you know, if they work, they'll have food. And so there are issues around lower wages, especially for African Americans, higher unemployment rates, and just historic discrimination in housing and education. And so we heard the DC statistics, but nationally, I saw a report that said over 9 million Black people, including children, lacked consistent access to enough food, as what you were just saying, enough food for a healthy life. You know, and so there's some underlying issues for our communities. Can you say a little bit about that?
Absolutely. You know, sometimes it's not just, you know, I remind people it's not just let's put a grocery store in a certain community. It's not just order DoorDash or, so on and so forth. Sometimes we have to look at the interconnected pieces of our food system. And that's where we have conversations on economic stability. We have conversations about affordable housing, affordable childcare. DC has one of the highest rates of cost of childcare in the entire country. And so when we put all of that together, then we have a picture of what are the disparities that exist. For example, we release in DC, we release a grocery store report every year. This grocery store report talks about the lack of grocery store access across the district. We have in Ward 8 about 78,000 residents. For those 78,000 residents, we have one full service grocery store. Compare that to Ward 3, which is our highest income earning ward. They have upwards of, there's about 4,400 residents, I believe. They have upwards of 15 grocery stores. And so when we think about that, the residents that are also residing in Ward 8 east of the river, and I want to preference east of the river, there's challenges when it comes to accessing transportation. Sometimes it's not easy having accessible metro stops. And so when we're talking about individuals and residents in any given jurisdiction, not just DC or Maryland, when we're talking about accessing food resources, we have to talk about, number one, food affordability. Is that food, can I afford that food? And how do we afford that food? Our jobs. Economic stability. Do we have high paying jobs? Are we earning a livable wage? Can we afford the food in our community? After we've had this conversation, or even simultaneously while we're having this conversation on food affordability, we have to talk about transportation. Is it easy to get to the food? Not everybody has access to transportation. Our older adults, for example, it may not be that they don't have access to transportation, but maybe there's mobility issues. Maybe it's not easy for me to get up and go to and from a store. I can remember one time talking to a mother. She was a mother of a newborn and a toddler. And she talked about how difficult it was and time consuming it was. I've got to pick my child up from school. I have a newborn that I have to get together. And then I have to go to the grocery store to get items for dinner and then come back home and prepare that. So there's all these factors that food is not linear. So there's all those things that we have to consider when we're talking about food security, including making sure I have somewhere to store the food. How can I prepare the food? So there's all these different pieces of the puzzle that we have to put together before we can just issue a response or a solution. It really is a multi-factor, multi-system approach to addressing hunger, poverty, and its root causes.
How do we help? How does somebody help?
There's so many different ways that folks can help. One way is definitely connecting with your local legislators. Currently, right now, we are at the federal level and at the state levels. A lot of states are in the process of their legislative sessions. Communicate with your legislators, their constituent services. This is what's going on in my community. I need you to respond this way. Organize. Have your neighbors show up, hey, there's this community meeting. We need to show up and we need to show out and we need to talk about the issues that are pervasive in our community. Sometimes legislators may not know. It's not that they don't care, but they just may not know because they can't be everywhere all the time, but maybe they just don't know. So it's communicating. Our food banks and our food pantries have been responding at just a massive rate, especially during the shutdown, even more so. And so if we can, where we can, support our food banks and support our food pantries, donate where you can, donate your time, your talent, your treasure to our food banks and our food pantries. You can also donate to Maryland Hunger Solutions and DC Hunger Solutions because we are absolutely in the business of supporting our residents. Volunteer with us. We love when we have volunteers. We have a full outreach team that is in the community that is connecting with residents. We table at several community events across DC and Maryland, and we love to have volunteers because it gives people insight into the work that we're doing that you may not necessarily know. Like, I didn't know this was going on. I didn't know that these conversations were happening. So we love to connect with people. to have them serve and to have them volunteer with us.
Absolutely. I know the world won't be changed except one person at a time. Who it's you say it's the have and have nots, but do the haves even think about the have nots to the point where their excess makes somebody's day? And so if LaMonika Jones was president, what would she do? what could we do without the red tape and all of the other, I almost said crap, but anyway, with all the other stuff that you have to jump through just to make sure that our children first, and then our seniors and everybody else has adequate access or has adequate food. I mean, I was thinking while you were talking, I was like, do any of the food banks, can we, because a lot of people do home delivery, like Giant, and I'm down in Georgia, Kroger, everybody kind of, even Walmart, all these guys do home delivery. Is it a way to implement any of that to make it easier on the people who can't really, even if they had the means, can't get out?
Yeah, absolutely. And that is.
I asked you a lot of questions, President Jones, so I'm sorry. Go ahead.
Oh, that president, we can take that president title. I think a couple of things that you said. Number one, I think you were spot on when you said remove the red tape. There is a ton of bureaucracy when it comes to accessing our federal nutrition programs. Make it easier. These are safety net programs. You think about just the image of the net itself, it's meant to catch something. So it is meant to support people and to catch them in a time of need when they're experiencing hunger and when they're in crisis. It shouldn't be difficult for people to apply for benefits. And, there's been conversations about making it even more difficult. The checks and balances are already in place. There's been conversations about fraud in our programs, which are, unfounded and untrue. But we shouldn't make it that difficult for people to do what is very basic. Food is a basic human right, and it's something that we need, and we should not make it difficult for people. So you were spot on with removing the red tape and the bureaucracy from accessing our federal nutrition programs. The second, thing you were also spot on was grocery delivery. A lot of that came out of the pandemic because we couldn't go to the grocery store. We couldn't be out in the open, as we normally did and do our normal daily routines and errands. And so we had an increase of grocery delivery, of mobile meals, to bring food to people. I am one that definitely will always advocate for meet people where they are. And that includes, if you're going to your doctor, your dentist, pediatrician, your school to pick up a child, why not make sure that the resources are there so that I'm not having to go make 5 different stops to get something that I need? If I'm having mobility issues, like the example that I used with the mother that had a newborn and a toddler, if they can receive grocery delivery home, if she could have that to her home, that would prevent her from having to go around. And so there's absolutely, outside of our larger grocery stores, there are smaller organizations that are doing just that, because a lot of times a smaller organization is able to meet the needs that a larger organization can't always do. So that's definitely something that is very, very viable for most cities and counties.
Mm-hmm. Absolutely. I don't know, LaMonika didn't talk about it, but these community fridges are popping up as well.
Yeah, I've seen the community fridges popping up, and that's even more of a hyper local response to what's going on. Setting up a community fridge and then donating directly to a community fridge, that has the possibility to, number one, provide a resource for our unhoused neighbors. When we work with those that are experiencing housing insecurity, a lot of the challenges that we have is just being able to connect with them because they don't have an address, and we don't have a constant way of maintaining contact with them. But a community fridge is a way that even our unhoused residents and neighbors are able to access that. And so yeah, I've seen quite a few of those pop up, and I think it's a good solution. I think, there's probably conversations that have been come up about food safety and so on and so forth and maintenance of it. But it's also something that I've heard is very impactful in the communities that are doing it.
Absolutely. Listen, the time is moving. If we could solve this, we would. Like say, Lord, solve it right now. But the Bible already says, if you believe this, that the poor will be with us always, which means we'll always need some type of solution to help with insecurities, and maybe the solution is the community that you live in. And I don't know if it's go back to block captains or whatever. We got to figure out that okay, because when I looked while we were talking, it's like this problem is not just in America. This problem is everywhere with the food insecurities, and so that means that nobody's really got it right yet. So some are better than others according to what I was reading, but still it hasn't been eliminated. And I think small groups are going to be the only way to really to look after it. I don't know if you go block by block or how when does community come in, because everybody's so it's about me. It's kind of anyway, we would talk forever.
No, I think a lot of the questions that I've been getting over the past maybe 6 months or so have been, what would you tell people? And it really is, we can't silo ourselves, and we can't just look out for oneself. This really is a community response. It really is as simple as checking on your neighbor, because number one, you can never look at someone and tell if they're hungry, if they've had enough to eat. I can't do that. I don't know that just by looking at you in most cases, but it really is checking on your neighbor. It really is a community response. It really is connecting with one another and coming up with viable solutions. Who better to advocate for solutions about food insecurity in your neighborhood than those that live in the neighborhood? You know what's best for your community and for your neighbors, because you live this and you see it. So no, community, I 100% agree. Community has, its place, and it's definitely front and center when it comes to addressing food insecurity.
So this has been the Chicken Box, powered by the Afro-American newspaper. That's right, the world's oldest media company, closing in on 134 years. Wow, that and we're not out here for clicks, y'all. We're not out here. We're out here just to bring great information to the community. Even if 10 people thought about making a difference and helping, however they could donate, however they could just be more aware of the food insecurities, the children. Just think about the children. I mean, a lot of the teachers see the kids come to school. They wonder why they're not performing. A lot of them are hungry. Think of how you perform when you're hungry. So a lot of them are, they're just trying to, to get that. Once they get that nourishment of you, they're gonna be running around, and they're gonna be productive, and they're gonna be more able to learn. That's just a small thing. I'm actually on a Chicken Box show right now, so I'm on the box, so I'm speaking my truth. I think it's selfish to always think one way and to only think about yourself and your family. This is Impeccable's personal opinion. These are not opinions of the Afro, but I think it's selfish, especially if you're African American, to think that there are people, once you hear these numbers of how many kids and seniors and people who don't have access to food, to not figure out some way to get involved with your time, talent, or treasure, like you said, LaMonika. I thank you for the work you did. You said you're trying to work yourself out of a job. You don't look like you're gonna do that, but you're the right person for it.
I appreciate that.
You're in the right place at the right time, is like they like to say. And we thank you for everything you do, not only in Maryland and DC, but just how you advocate globally as a global hunger solutionist. That's your new job. All right.
I like that. I'll take it. I'll take it.
Global hunger solutionist. There you go. And I'm off the box. You'll go last on the box. Dax Draper, you're now on the box.
Okay, so first of all, thank you for being with us today. We really appreciate that. It just occurred to me while you were talking. We really don't have a food problem. We throw away a lot of food. We don't have a food problem. And you didn't say we did. We have a food insecurity problem. We have a how we think about our neighbor, our community, other people. We have that kind of problem. We have we have issues with how we stereotype and talk about. So I really appreciate your language as well. I'm hoping our viewers picked up on it. You talked about our friends and our neighbors, right? We talked about our community because my mom used to always say, and your grandmother may have said it too, there but for the grace of God go I. You never know when this could be your turn to be somebody to care about you. And if you live long enough, you'll get to a certain age where a snowstorm like we just had would prevent you, even if you had the money to get to the grocery store, right? And so we have a heart problem a lot of times as well, especially amongst those who sit in some high places and make these rules and regulations and throw up these barriers for and make these assumptions about why people don't have what they need. And it is a basic need. So I want to just thank you for the work that you do. And I hope that this show and other things that, other ways of getting the word out. Because it's sometimes when we talk about people getting the help and assistance that they need, it's vilified. Like, you know, these are lazy people who, if they would just go to work, then they could eat. Well, even with the minimum wages increase, sometimes, you can go to work even for 40 hours and not have enough to feed your family.
Mhm.
So thank you for the work that you do. I hope this inspires all of us to be a part of the solution and not a part of the problem. And I am off the box.
LaMonika Jones, DC Hunger Solutions, you are now officially on the chicken box. And if you want to scream about whatever it is that you want to scream about, now's your chance.
Yeah. So I mean, I started this work as a high school teacher, and I taught high school with students that lived well below the poverty line, but also had friends that had no issues when it came to accessing food or any other resource. Their families were very influential. They had the money and means to take care of their children. And from that work, it was my eyes were opened even wider that there's nothing that anybody should have to prevent them. There should be no resource that is accessible to anyone to take care of themselves. And that includes food. And many of my students that I taught were food insecure. As I've gone through the trajectory of, my career and this work, it's become even more apparent that food is basic, and there should be nothing that prevents an individual from accessing a food resource, something as basic as food. Um, the decisions that are made by those that are in charge in terms of making it challenging, it really is a moral decision. There should be nothing that prevents anyone from accessing food resources. That includes making sure that food is affordable, that it is culturally relevant, that it is they have the economic ability to pay for the food, and that goes into housing. I can afford to cover housing, childcare, all of the things. Um, and it really is a collective of response. I think this very day, with everything that is happening around us, we can't afford to ignore the situations that are impacting our community, and that includes food security. We can't afford to ignore the thousands of children that could potentially lose eligibility to free school meals through the community eligibility provision, or a household that would lose benefits to SNAP. We can't afford to ignore the advancements that have been made, even since the pandemic, with ensuring that families have the resources that they need, food and financial resources that they need in order to live and to survive. It's not it's expensive to live nowadays. Rent is expensive. I always say the rent eats first, or the mortgage eats first. Those are the bills that we pay first. We pay our rent and our mortgage first, then we pay for everything else afterwards. And food is sometimes the last thing that is thought of. But we can't afford to do that. It's expensive. Life is expensive. Daily life is expensive, and it is our responsibility as neighbors, as community members, as leaders in our respective spaces to make sure that we are taking care of one another, that we are holding leadership accountable for making the decisions that will impact our community, that we are responding in a way that thinks of the least of these first. It's not just about you and I. And I think Dr. Draper and Impeccable, you both mentioned it. It's not about I. It's about we. It's a collective response. It's the system's response. We can't silo ourselves in food. We really do have to look at this from a systems perspective in order to ultimately end hunger and ensure that all of our neighbors, our families, our households have everything that they need to take care of themselves.
Well, thank you, LaMonika Jones. Thank you, everybody who's listening now live, or you decide to share it. Wait a minute, let me say it again. How about everybody share this this thread and this message, this podcast, whatever you want to call it. Share the little button that goes over like that. Just hit share. And how about everybody find a way? Go up on the website wherever you are and look for hunger solutions or food insecurities, and figure out how. If you can't do that, look around your block. If you can't do that, look at your church, look at your community, look at your aunties, look at your uncles, look at your family, look at your seniors. You're like, how can I help them? You might can just send them some food. It'll show up right on their porch. I know I don't even like to carry the big thing of water. It's too heavy. But so if I don't like to carry it, I can imagine what a senior would love to have some cases of water or some other things, non-perishables or some other things. I'm telling you, to make somebody's day. Send them some food, and it'll do, and then pay it forward to the next person. That's how you can help, because we're not going to get through that. That red tape is like thick. I don't even know if it's called tape anymore. It's like red. It's red cement at this point. But anyway, this has been the Chicken Box, powered by the Afro News. Go to afro.com. We'd love to have your subscription. We need you, because nobody controls our voice, our airways, and nobody controls the stories that we share about our community and about the amazing Black people in the world, and especially in the DMV. So until next time, Dr. Draper and LaMonika Jones, you're always a friend. You're now the Afro's global hunger solutionist. So if we need to call on you to do a drop or a spot or a highlight, we're gonna do it. But
please, I'm here. I'm here. Please do.
So when you need us, we're also here. We hope to be here for the next 130 years. Dr. Draper, our CEO, Afro News, and AJ, our producer. And Jay Jackson, who's in Costa Rica, Puerto Rico somewhere. You're missing all the snow. We miss you. We'll talk to everybody soon. And everybody, don't be selfish. You don't look good on me. I'm going to get a shirt that says don't be selfish. Have a great day, everybody. Bye-bye.